Promoting equality for New York City moms giving birth. Now, two Queens hospitals fight racial and ethnic disparities with a free program for pregnant women. Thank you for staying with us. I'm Erin LeBeau.
And I'm Tamsin Fidel. Well, the New York State Department of Health analyzed all pregnancy-related deaths in 2018, and they found that Black non-Hispanic women are 5 times more likely to die of pregnancy-related causes than white non-Hispanic women. As New York City fights to end the disparities, the Hope Doula program provides support for those who need it the most.
So joining us now to talk about it is the leader of the Hope Doula program, Dr. Sheila Maru. First of all, thank you for being here.
Thank you.
Now, we know in the U.S., midwives as well as doulas aren't as common as other places. Can you explain to us what a doula does compared to a midwife?
Yes, definitely. So I am an obstetrician gynecologist, so I provide kind of the highest level of care when there's an emergency during pregnancy or birth. Midwives provide care for pregnant women and birthing people who have a normal pregnancy. And doulas are lay support people. So people who are community members, could be living in your neighborhood, hopefully speak your language, and provide lay support, comfort, counseling, and accompaniment. They develop a trusting relationship with pregnant women and then support them through their birth and through those early, really difficult days of the postpartum period and early childhood.
Yeah, I wanted to talk about that, and you touched on a few of the points, but it's really important for pregnant women and moms to have a doula. Can you go into that a little bit more in terms of what you're seeing?
Yeah, definitely. I agree that it's very important for moms to feel supported during pregnancy and feel like they have someone that they can trust and talk to, ask questions to, and help guide them through the really difficult questions of self-care and care for their newborn baby after birth. So doulas provide all of those types of support. And in addition to that, community-based doulas are also doulas who provide connections to community resources for things like food pantries, housing resources, immigration support, legal support. So they really become a trusted community member that can not only help with the specific issues of pregnancy, birth, and postpartum, but also connections to other important social concerns that can ultimately affect anyone's health.
Mm-hmm. So Dr. Maru, can you tell us a little bit about the Hope Doula program at Elmhurst and Queens hospitals and how you're really trying to make this program and doulas more accessible to more people?
Yes, definitely. So the Hope Doula program is a collaboration between the Mount Sinai School of Medicine and New York City Health and Hospitals. And it was really designed to address some of those health disparities that you spoke about at the beginning of this segment. So women in New York City, women of color, Black women, Hispanic women, Asian women face much worse outcomes, unfortunately, compared to white women in the city when it comes to birth outcomes. And doulas are a promising solution for this issue. So with the Hope program, we are providing free of cost doula services for people who are getting their care through Elmhurst and Queens hospitals, which are both of the public hospitals in Queens. And we have worked very closely with the Community Advisory Board. So we're gathering input from community members and from community-based organizations on every aspect of the design and implementation of this model. And we have recruited and trained a whole new cohort of doulas who live in Queens. So the doulas who are part of the Hope program are your neighbors, and they speak the languages that you do. And they are the ones who would accompany you, become your trusting friend and counselor during pregnancy, birth, and postpartum.
Are there plans to expand the program beyond that area right now if someone is watching this and they're wondering about that?
Yeah, that's a great question. We do hope to expand Hope at some point, but there aren't any concrete plans at this moment. For now, we really are focusing on doing the best that we can with high quality implementation of the program in Queens.
So before we let you go, where can people go for more information about the Hope Doula program?
Yeah, so anyone who wants to be referred to a doula through the Hope Doula program can ask their provider at Elmhurst or Queens hospitals during prenatal care, and we can get the process started for matching you with a doula to have you have that service throughout the pregnancy and birth.
Wow, thank you so much. So much great information there. We appreciate you joining us.
Thank you.